We continue with the viral infections of gastrointestinal tract, and the first infection is infection gastroenteritis that's caused by a rotavirus. Rotavirus usually causes gastroenteritis in newborns in hospitals, and it is transmitted by fecal oral route. As I said, usually affects infants and young children. Usually we have outbreak in the winter time. The symptoms of infection will be fever, vomiting, nausea, diarrhea. There is no specific treatment since it is a viral infection, and infection is recurrent because usually children do not develop immunity against this virus. Next one is a Norwalk virus. Infection is fairly new. The first outbreak there was in 1969 in Ohio, Norwalk Elementary School. And today this infection is known as infection that usually affects people on the cruise ships. So Norwalk virus causes gastroenteritis. It is transmitted by fecal-oral route of transmission. Infection is self-limiting. The symptoms of infection are nausea, vomiting, diarrhea, abdominal pain. Usually infection lasts for about 2-3 days and doesn't require any specific treatment. It's easy to prevent this virus, so if you get on a cruise ship, use hand sanitizers a lot because Norwalk virus is very sensitive to hand sanitizers. Next group, those are protozoan infections. We start with amoeboic dysentery caused by Entamoeba histolytica. Entamoeba histolytica is amoeba. It can exist in two stages, as a vegetative stage, actively growing protozoa, and also it can form cysts, which is the resting stage of this protozoa. The source of infection will be infected individuals and contaminated food, transmitted by fecal-oral route. The most patients will not develop symptoms or develop just mild symptoms of diarrhea. But some patients might develop symptoms of amoeboic dysentery, which is abdominal pain, cramps, fever, and bloody mucoid stools. Infection is very easy to diagnose. It can be diagnosed serologically, or it can be, but the pathogen can be identified from the stool of the patients. There's one very dangerous complication that can be caused by Entamoeba histolytica. Entamoeba histolytica can cause liver abscess, and as I said, this is a life-threatening complication. Next protozoan that also can cause GI tract infection in humans will be Giardia lamblia. It is a flagellate protozoa, and the source of infection will be contaminated food or infected individual. Mode of transmission is fecal-oral or through contaminated food or water. This infection has two stages. They're called, the first stage is called the early symptoms of giardiasis, and the early symptoms of giardiasis are explosive diarrhea, bloated abdomen, large amount of foul-smelling gas. If infection is not treated, the symptoms will go away, but then patient will develop next stage of giardiasis, and we call it long-term symptoms. And usually patients come to see doctor with the long-term symptoms. They usually complain that something is wrong with their GI tract. Sometimes they have abdominal pain and feel constipated, and then the symptoms are gone, and then symptoms come back and they feel nausea and they have diarrhea, and then again the symptoms gone and then come back. So if patients come to see doctor with this kind of symptoms, we check a stool of those patients for the presence of Giardia lamblia, and most of the times were able to find it. And we continue with helminthic infections, and as I said previously, the most common helminthic infection in the United States is a pinworm infection, which is caused by Enterobius vermicularis. It is a small round worm. We already talked about life cycle of the pinworm. I'm not going to stop on it once again. You can go to the previous lectures and review life cycle of the pinworm. Just remind you that to diagnose this infection, we use what we call tape test. Basically, we use a sticky tape that we apply to the mucous membranes and the mucous membranes of anal area of patients in the morning. And if then we place that tape on the surface of the slide and look at it under microscope, we're able to see eggs of that worm if patient is infected. Next roundworm is Ascaris lumbricoides. It's a larger worm. It can reach up to 12 inches long. And Ascaris lumbricoides has a complex life cycle. Humans usually get infected when they ingest eggs of this worm. Within GI tract of that patient, eggs will hatch in the larva. Larva is motile. It can move into the bloodstream, into the lungs, and actually those patients, if larva gets into lungs, cough larva out of lungs and then swallow back into GI tract. Where a worm continue growing and it develops into adult worm. Adult worms start producing eggs, and infection doesn't produce symptoms until infestation becomes really heavy. When infestation becomes really heavy, worms can come out of the nose of the patients. Also, worms can block and cause obstruction of GI tract. Patient also can develop symptoms of hypersensitivity reactions, for example, asthma-like symptoms. Next worm is what we call hookworm. It's a roundworm as well as the previous ones, and this is an infection that can be seen in tropical areas. Eggs of hookworm actually hatch in the soil and develop into larvae. If humans, people walk in that infected soil with no shoes on, a larva can penetrate through the skin of those humans, and then actually the life cycle of hookworm are then very similar to the life cycle of Ascaris lumbricoides. But because hookworm has hooks and has ability to attach to the mucous membranes of the intestinal tract, it starts actually sucking blood from the GI tract of those patients. As a result, patients can develop symptoms of profound anemia. So patients will suffer from weakness, fatigue, sometimes they have nausea, vomiting, diarrhea, all those kind of symptoms. For the treatment, we use anti-helminthic drugs. From this slide, guys, the last two infections, helminthic infections, that you have to know for your final exams. Once again, we talked about Trichinella spiralis. It causes trichinosis in humans, and we already talked about life cycle and this infection. So go back to your previous infections and review, just recall all information about Trichinella spiralis. Speaking about tapeworms, once again, we talked about life cycle and structure of the body of the tapeworms. So go back to the previous lectures and recall the information. You also have to know that tinea means tapeworms in Latin, and they belong to a group of flatworms. And you have to know two specific tapeworms, tinea saginata, which is a beef tapeworm, and tinea solium, which is a pork tapeworm. And in the last part of this lecture, we will talk about infections that affect liver. We'll start with hepatitis. Uh, there are different types of hepatitis virus that can cause actually hepatitis. The first one is called hepatitis A. Hepatitis A is caused by hepatitis A virus. Hepatitis A is also known as infectious hepatitis because usually the source of infection will be infected individual or contaminated food, and mode of transmission of this type of hepatitis will be fecal oral. The main mode of transmission for hepatitis A is fecal oral route of transmission. This infection has pretty long incubation period. The incubation period can be from 2 months and it can be as long as 6 months. And also you have to remember that young children very often usually develop asymptomatic type of hepatitis, means they do not produce any symptoms. Adults, though, will develop symptoms of hepatitis A, but the first symptoms that they usually develop will be symptoms of upper respiratory tract. So basically they come to see doctor and they complain on a high fever, headache, muscle aches, conjunctivitis, running nose, and then a week or so later they come to see doctor again, and then they say that they actually have nausea, vomiting, loss of appetite. They complain on the taste disorder, smell disorder. Of course, as a symptom of hepatitis, they develop jaundice, and the urine of those patients is going to be dark. The stool of those patients will be light. Since it's a viral infection, there is no specific treatment, and usually most of the patients will recover within 1 or 2 months from infectious hepatitis, and some patients might develop complications, but usually the hepatitis E is very benign type of hepatitis that doesn't produce too many complications. Vaccine is available today. Next type of hepatitis is hepatitis B, which is caused by hepatitis B virus. Hepatitis B is also called serum hepatitis because the main source of infection will be blood and blood products. Hepatitis B has 3 different antigens in its structure. The first one is hepatitis B surface antigen. It can be found on the surface of the virus. The next one is hepatitis B C antigen, which is found on the core of the virus. And the last one is hepatitis B E antigen that is found on the capsid of this virus. When we actually detect levels of different types of antigens in the patient's serum or antibodies that produced by immune system of the patient to those antigens, we can figure out if our patient is in an acute stage of infection or goes through recovery, or if patient developed actually chronic hepatitis already. As you see, this type of hepatitis has a pretty long incubation period. It's average about 75 days. 50% of patients will not develop symptoms of hepatitis at all. But hepatitis B is more dangerous type of hepatitis, and as you see, some patients may develop liver cancer because hepatitis B virus can cause liver cancer, or cirrhosis, and from 2 to 10% of those patients will become a chronic carriers of that virus. There is no specific treatment since it's a viral infection. Hepatitis B vaccine is available today on the market, and you as a medical workers have to remember that it's mandatory to be vaccinated against hepatitis B when medical workers work in the hospitals with the patients. Hepatitis C. Hepatitis C is caused by hepatitis C virus. The main modes of transmission for this infection will be through the blood or sexual contact. Usually, this hepatitis, a type of or kind of hepatitis, can be seen in the high-risk groups of the patients, for example, patients that go through dialysis, or patients that had blood transfusion. This infection has pretty long incubation period, up to 6 months, and as you see, this is probably the most aggressive type of hepatitis because in the 50% of cases, patients will develop chronic hepatitis. Next is hepatitis D. You have to remember that hepatitis D is caused by hepatitis D virus, and by itself, this virus is not very aggressive. But hepatitis D is a co-infection with hepatitis B. It means usually hepatitis D virus infects only people that are already infected with Hep B. And because the liver of those patients is already compromised by Hep B, that's why hepatitis D can be very serious because it can lead to the chronic liver infection and failure. And the last one is hepatitis E, caused by hepatitis E virus. Infection also can be seen in Asia, Africa, India. And the mode of transmission of this type of hepatitis will be fecal-oral. In most of the cases, hepatitis E is a benign type of hepatitis. Infection is self-limiting, doesn't causes too many complications. But the only group of patients that we usually worry about when we're talking about hepatitis E is pregnant women, because in other cases, hepatitis E virus can cause a lot of complications. And the last, we're going to talk about helminthic infections of the liver, and we will talk about liver fluke. As you remember, flukes are flatworms. There's no liver fluke in here in the United States, so that's why we're not going to stop on this infection in all details. As all flukes, this worm requires intermediate host, and in this case, you see on the picture, you see snail. When patients get infected with this infection, as I said, this worm usually affects liver. So patients basically develop symptoms of hepatitis, which are enlarged liver, tenderness, and of course jaundice. You don't have to memorize specific and general names of those worms, but what you have to remember is this infection can cause very serious complication. This worm can cause bile duct cancer in those patients.